Welcome, everyone. So excited to have you all joining us for this conference. We are excited to have everyone with us, and I know more people are joining us, and we also have a lot of people who are joining us on Facebook as we are also live streaming this. Everyone's been muted, so feel free to use the chat as we begin. And I would like to begin by acknowledging that I am in Mi'kma'ki. This is the ancestral and unceded territory of the Mi'kmaq. Their inherent rights to this land were recognized in the peace and friendship treaties which Mi'kmaq, Wolastoqiyik, and Passamaquoddy people signed with the British Crown from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between multiple nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act in 1982, and they remain active to this day. I want to invite all of you who are joining us to use the chat to join with me in this land acknowledgement. You may need to Google if you are not familiar with the correct term for where you are joining us from. So for example, I am in Unama'ki, and so if you can just put in the chat your name and where you're joining us from so that we can all join together in acknowledging this land where we are. The Nova Scotia College of Social Workers joins our members and our communities in the necessary labor of reconciliation. We are grateful to live and work together as treaty people in Mi'kma'ki. Without action, acknowledgements are empty. Whether you are with us in Mi'kma'ki or joining us from elsewhere, please consider whose territory you are in, your relationship with that land, and your relationships with the Indigenous peoples who have lived and continue to live in that place. We invite you to reflect on how each of us, as individuals and as a collective body of social workers, can hold ourselves accountable to reconciliation with Indigenous peoples here and across Turtle Island. Walalu. Thank you all. Please feel free to continue joining with me in this land acknowledgement through the chat. So place in the chat, my name is, I'm joining from this territory, so that we can all collectively join in this process. So I am excited to welcome Alec, who's our executive director, and Alec is going to share a few words of welcome to us. So with that, I'm going to spotlight him.
Good afternoon, everyone. Good Friday afternoon. It's really exciting to see in the chat where folks are joining us today from. It's not just all over Nova Scotia. It looks like it's from all over the world, which is really exciting in terms of what we're talking about today. We are talking about mental health and social justice, and the reality that the predominant amount of our systems are not focused on what is at the root cause of much of the mental distress that happens in our society. We know as social workers, and for those joining us, that a person's mental health is shaped more by their experiences with our economic, social, and political systems. And that if we are to substantially improve the overall mental well-being of all people in our society, we must take a political approach and we must take a social justice approach. What this means for us and what this means for us today gathering is that from the ideas we generate and the momentum that comes out of this day, we have to be able to turn that into pointed political action for change. Today is about that. We are going to generate more ideas, more discourse, and then at the end of the day, the Social Justice Committee of our College of Social Workers in Nova Scotia, whose duty is to protect the public interest of Nova Scotians, is towards this type of political change. And so we look forward to the journey today, the conversation, the enriched content that our researchers will be providing in terms of this issue and where we need to go with it. Again, I'm so thrilled with the attendance today. I want to, if in case I forget at the end, really give a really authentic congratulations and thank you to the NSCSW team, led by Anne and Rebecca and Suzanne, who were able to pull us all together today for this incredibly important conversation on a Friday afternoon, nonetheless. So I am going to be listening intently and looking forward to the conversation as we move forward. And thanks for giving me space to say a few words. I'll hand it back over to you.
Okay, thank you so very much. And we have several other people who want to say a few words. So I'm going to continue here. Hold on one second. So I now want to invite Karen Nichols, who's the Executive Director of the Canadian Mental Health Association in Nova Scotia. And Karen wanted to share these words with everyone. So I am excited to invite her to speak.
Hello, friends. My name is Karen Nichols, and I'm the Executive Director of the Canadian Mental Health Association, the Nova Scotia Division. We're a small but mighty team of about 19 in Nova Scotia, but we work with our branches in HRM, Colchester East Hants, and Southwest Nova to support the resilience, the recovery, and the well-being of people living with mental illness and those experiencing mental health challenges across the province. We're also part of a federation, which is a collective of organizations across the country bound together by brand and mission. And together we push for nationwide system change. Most recently, we've been working with colleagues across the country and in particular in Ottawa to push for a national universal mental health care. And that work continues for sure. In Nova Scotia, our work focuses on three sort of distinct pillars. We educate, and through our free programming, we provide a greater understanding of mental health issues through inclusive, evidence-based mental health programming and education across the province. We are committed to ensuring this programming is accessible and meets the evolving mental health needs of all Nova Scotians. Beyond that, we navigate. Our research has shown us that Nova Scotians really don't know where the front door is to get access to their mental health needs services. The system is complex and it's pretty confusing. So we connect all people in Nova Scotia with safe, inclusive, culturally relevant, accessible mental health programs, services, and support. And finally, we advocate. We work with our partners to push for new systems, policies, and practices that consider the social determinants of health to increase community capacity and foster better mental health and well-being for all Nova Scotians. I'm really so grateful to have been asked by Anne to say a few words today. It's really important to me. I know that you know this is good work. It's also hard work, and it's work that requires a broad reach into the community and a full court press on all levels of government. This is why it is so important that we work together. Together, we need to push for an increase in public funding of mental health and addiction services to represent 10% of the total Department of Health and Wellness budgets, as recommended by the World Health Organization. We also need to advocate for long-term and stable federal and provincial funding for key programs, services, and supports that we deliver. We need to ensure that those in power understand the importance and invest in those upstream social determinants of health, such as housing, income support, and food security. I am so deeply grateful for the work that you all do. Thank you for your continued dedication and for being such a critical piece in the social fabric that holds our communities together. Together, I know that we can get this work done. Thanks for your time and have a wonderful conference.
And thank you, Karen, for sharing those words. We are grateful to have several people with us who are joining us in this conference. And I want to now invite Tessa Morse, who is policy analyst with the Office of Addictions and Mental Health. I'm grateful that she is joining us today as well. It's so important that we are working to try to collaborate with others as part of the change that we want to see. So I'm going to invite Tessa to say a few words, and I'm going to spotlight her.
Thanks so much. Yeah, appreciate the opportunity to say a few words and talk about some of the work we're doing. So I work for the Nova Scotia Office of Addictions and Mental Health, and that's a provincial government department that sets policy direction, priorities, and standards for mental health and addictions care in Nova Scotia. We work closely with the Nova Scotia Health Authority, the IWK, community and government partners on mental health and addictions care matters more broadly. And the office is currently working to improve access to mental health and addictions care across the province. So the minister mandate letter for the office outlines 15 mandate items that inform the establishment of a framework to support universal mental health and addictions care for Nova Scotia. So part of this is to look at options to support access to allied mental health professionals, but that's not all. We know this can't be done in isolation of looking at the whole system, and we're seeking to identify areas of the system that can improve access to care. And we're not starting this work from scratch. We have many key evidence-based mental health services and supports we can build on, including those offered by social workers. We have a publicly funded system of mental health and addiction services and supports through the IWK and NSH, increased virtual care options, community-based services and supports, programs offered through other government departments, and really willing stakeholders and partners. We really appreciate the expertise and knowledge of social workers, and we value your thoughts as we work on this plan. And in our work to improve access, we actually had an engagement session yesterday with social workers in Nova Scotia, and I was really impressed how many responded to our call and attended this session. A very engaged group, which is great. And if you weren't able to attend the session yesterday, I'll send out a link and we can get your feedback, written feedback there. And the last thing I want to say, so a colleague of mine from the office who is reviewing research for universal mental health and addictions care in Nova Scotia is also on the line today. So Victoria De Silva, there's a lot of faces here, but she's here. And we really look forward to hearing about some of the research today. So thanks very much.
Thank you so very much. We are grateful to have you here and listening to our voices, not just in terms of the research that we've already shared with you from our repositioning report and the research that Dr. Katrina Brown and her team will be sharing with us, but also wanting to hear individual feedback. And of course, this is part of our larger advocacy efforts, as Alex shared, and as you will also learn more about as we continue. So we are excited about the opportunity for us to come together. And with that, I do want to now thank Dr. Katrina Brown, Dr. Marjorie Johnstone, and Katrin Dahl for joining us to share their research, interrogating the impact of neoliberalism on social justice approaches to mental health in social work. And we are all really lucky to get to hear from Dr. Katrina Brown, who is an associate professor at the School of Social Work at Dalhousie University and was one of the co-authors of the mental health report that was published by us in 2021, Repositioning Social Work Practice and Mental Health in Nova Scotia. And Dr. Marjorie Johnstone, who also was another one of the co-authors and is also an assistant professor at the School of Social Work at Dalhousie University. And then last but definitely not least, we are so grateful to have Katrin, who is a PhD student at Factor in One Tash Faculty of Social Work, University of Toronto, and Catron's doctoral research focuses on the experiences of queer, trans, and gender diverse people in sport and the intersections of queerness, resilience, and mental health. We are grateful to have all three of them with us. So thank you all very much for joining us today. And with that, I'm going to stop my share.
Hi, can you hear me? I'm actually starting.
Oh, awesome.
Yeah.
Dr. Brown, yes.
Hi, yeah, I'm Katrina Brown, and the whole team that is present for this presentation is very happy to be here today to have a chance to talk with people and to brainstorm with people and to do both a sense of critique as well as a sense of what possible actions we might take going forward. We appreciate the comments of the previous two speakers and are emphasizing throughout our presentation that mental health is a social justice issue. That is our primary emphasis coming out of the research we're going to present, as well as the Nova Scotia research, which the current research grew out of. And as well, the international research that exists also supports this approach to thinking about mental health. And it includes both issues of access, as well as, though, a reframing of how it is we talk about and think about mental health. And then further to that, how social workers are positioned in that process. So it's all of that. And we will only really be able to do some of that today, clearly. It's an ongoing project. So today, as N said, we have myself, Marjorie, and Catron presenting, but we're part of a bigger team that was essential to the entire project occurring across provinces in Canada. So with that, I'm just going to figure out how to move the slide. There we go. So you already know that we're focusing on mental health. And we're focusing on it as it exists across Canada, or a sense of that in talking to social workers. And we focused on basically three yet distinct issues. The first is really looking at what are social workers' beliefs about mental health and how do these beliefs affect their choices of how they would like to approach working with people who have mental health and substance use struggles. And then further to that, how do organizational ideas and practices influence mental health treatment options? And then last but not least, the extent to which mental health services delivered by social workers actually challenges or reinforces some of the neoliberal ideas on mental health, which actually we will be critiquing. So it's clear that from the Nova Scotia study in 2019, as Anne mentioned, which produced a report which focused on repositioning social work practice in mental health in Nova Scotia, that there are some serious issues that need consideration. What that study showed, and which led to this one clearly, is how professional and ethical paradigms of social work are often deeply in conflict with the dominant biomedical model and framing of mental health and substance use issues, and that social workers themselves often feel, given our training and paradigm, that we don't have a strong enough voice or opportunity for input in the provision and policy of service delivery. We don't see things exactly the same way as psychiatry, psychology, and medicine. We have our own framework. Social workers know that, and that framework is often subordinated to the more dominant framework. And that's something we would really like to reposition. So our findings then from this Nova Scotia study were very powerful and surprisingly, overwhelmingly consistent among the respondents, set the foundation then for the current study that we're talking about today. So before I actually continue on, it's really important that I actually talk a little bit about what do we mean by neoliberalism and biomedicalism, because I just want to make sure that we're on the same page about that. So when I talk about, and when we talk about neoliberalism here, we're really talking about a philosophy and set of practices that are significantly influential in determining in the current late capitalist political, economic, and social emphasis on fiscal constraint individual responsibility for their own well-being, and in the reduction of welfare state funding and programming. So that causes social workers a lot of trouble. And then biomedicalism refers to the sort of overarching dominant approach that prevails within the service delivery of mental health, which is more of a focus on biology, the individual deficit, rather than overall social context in which individuals live, and which others have already spoken about. So social workers have expressed significant concern about the gaps and disconnection between their own professional education, training, and philosophy and the actual demands of the mental health workplaces. There's concern about the way in which programs and policies focus on standardized short-term procedures rather than on collaborating with other models of delivery, such as the way social work would see things. In the end, taken together, there's a powerful influence when you join neoliberalism and biomedicalism, and we'll talk about that today. Both are powerful, and they work together to create a particularly limiting and problematic understanding of mental health issues and way of approaching service delivery. Really briefly, I just want to refer a tiny bit to literature only because I want to make sure that you're aware that the findings that we have found don't exist just somehow uniquely to Nova Scotia or even to Canada, but that are grounded in a much broader international look at these questions. In other words, we as Nova Scotians and Canadians are concerned about these issues, but so are people in other countries as well, also influenced by the impact of neoliberalism and by the biomedical predominance. So it's been a real concern among professional mental health and service providers under the influence of neoliberalism because of the way that it seems to be reshaping social work practice, and not from our own choosing, not from our own preference, but rather literally sort of imposed on us largely by the impact of the economic restraint that we get faced with, everyone gets faced with. So these struggles are described by mental health social workers whose training and social justice approaches are often at odds with the neoliberal politics, which center on the individual and individual responsibility. So this sort of not just infiltration, but sort of entrenchment of neoliberalism on mental health and well-being really sets up a focus on individuals being responsible for themselves. I mean, after all, if there's a lack of programming, a lack of resources, a lack of places to advocate, people might go and get support. Generally speaking, there's not enough, we know that. And you put that together with the fact that there's all of the fiscal constraint, the focus comes back then on the individual. It's your fault, it's your problem, you need to fix yourself. So the emphasis at large, including one that individuals themselves take up, is one where we tend to honor, value, and really highlight today under neoliberal sort of late capitalist ways of approaching people, that everyone needs to be super self-managed, regulated, and ultimately responsible for their own general well-being and own recovery, and perhaps their families. It's highly valued and it's emphasized in ways that is often not even unpacked. So we champion, oh, look how powerful you are, look how responsible you are, look how well you cope. And this plays into, at times, this notion that it's all on the individual to manage themselves, which is really an impossible requirement very often. So the research on mental health and neoliberalism in the United Kingdom and in Hong Kong has really focused on how managerialism, in other words, how we offer services often from a managerial perspective, produces conflict and power struggles between different actors within systems of delivery, and often produces a devaluation of social work within a fragmented system. And social workers are often finding themselves ambivalently compliant to the values of neoliberalism that they experience in the workplace. And a larger study, a 6-country study, looked at the impact of neoliberalism and inequality. And of course, it's generally sort of agreed among those who critique this system of economics that that what it has done is it's really increased the amount of economic and social inequality that we've seen. So we see all of this increased inequality and at the same time a decrease in the amount of services and funding that goes into providing services to people that are widely and broadly impacted in terms of mental health because of various effects of economic inequality. So that's a big social problem, which requires government and it requires funding revision. So that study that I'm referring to, the 6-country study, emphasized the important interconnection and interdependence of individuals and their society. And we as social workers know that. That is our general way of seeing things. Indeed, our ethical framing within our professional bodies centers on the notion of social justice and on the idea that individuals and society are interconnected. And from there then is the understanding that private troubles, individual struggles, and public issues are inseparable, and that we stress while social work faces challenges and conflicts internationally, right across the board, really importantly, it's important for the profession to find its collective voice, to understand, analyze, promote, and develop strategies to deal with the impact of neoliberal reform if we're to remain relevant. And so as we move on toward the end of the presentation and talk more about recommendations, and then we engage with you around your ideas, we want to move the conversation a little bit further along into the idea of strategies and ways that we might do some things differently. The rationalized and constrained economic practices of neoliberalism extend into corresponding social and individual practices, which is supported by a much larger kind of ongoing increased medicalization of social life. And where we can see that is on the one hand, the emphasis on diagnosis and the overuse of the DSM as a tool. And at the same time, the standardized one-size-fits-all short-term approaches to practice. And when we see the seriousness of the struggles that people have, often what we see is a conflation between trauma and difficult life circumstances, alongside then the impact of that on mental health, which is often depression and anxiety, for instance, and then often a sequelae of that is the use of substances as a way in which to manage and cope with the effects of all of it. So there is no way that we can ever work effectively with any individual coming forward for help on those sorts of issues in a matter of 6 short sessions, which is often what's allocated within systems of practice. That's hardly long enough to actually establish a therapeutic alliance. And so it's deeply flawed. It shows a lack of understanding of the complexity of the issues. There's a growing call then for a reconfiguration or restructuring of social work in response to neoliberalism and of the injustices produced by the conflation of neoliberalism and biomedicalism on the provision of mental health services and social work. And yet social workers have been asked to sort of somehow practice within those approaches, and it produces a moral distress and often leaves social workers feeling as though their hands are tied behind their back in terms of how they can practice. Now on to you, Katrin.
All right, thanks so much for that, Katrina, and giving us a good contextualization. So I'm going to talk a little bit about the study methodology, and I'll start off with a national study. The data for this study was collected through online surveys and semi-structured narrative interviews. In total, we had 357 participants complete the survey. And then we had 119 interviews that were conducted with social workers from New Brunswick, Manitoba, Ontario, and British Columbia. Social workers were recruited through various national and provincial social work professional associations, as well as various listservs, connections, social media accounts, anywhere where we thought that there would be social workers working in mental health. In terms of data analysis, so thematic data analysis was really exploring participants' accounts of social work and mental health care through identifying and analyzing participants' narratives of social work services, in addition to the discourse analysis. And this was really for the exploration of the meaning of narratives, contextualized within a broader social discourse of course, neoliberalism and biomedicalism, and how that affects mental health. In terms of our national survey results, so we pulled out some of the really significant statistics here. So 98% of those who took the survey believed that there needed to be a change in the provision of mental health care services. 81, if we just go back, there we go, thank you. 81% did not feel that social workers' training and perspectives had enough recognition in the current delivery system of mental health services. 78% were never, rarely, or only sometimes satisfied with the role of social work in their province. 54% of social workers, when asked about specific policies, noted that they had little opportunity to shape the policies that determine practices in their work environment. 91% of those surveys felt that they experienced some barriers in offering mental health services in the workplace. 66% felt that were not enough resources for their clients. And this had really been heightened by the COVID-19 pandemic, of course. 83% of respondents recognize that marginalization plays a role in mental health problems. And then 50% of social workers identified tensions specific to the supervision they received, and primarily as a result of not having a social work supervisor, and this contributing to the devaluation of the social work profession within their workplace. So as Katrina noted, we also conducted a Nova Scotia study, and extensive literature review was done with a focus on approaches to mental health, social justice in mental health, and non-biomedical model approaches. So that was really the focus of that literature review for the study. Data collected for the Nova Scotia study was done through, again, online surveys, interviews, but we also did focus groups with this study, and really exploring the experiences of social workers in mental health care. And we did this among service providers, those who are supervisors, and then also among people who are accessing services. So this survey had gone out through the Nova Scotia College of Social Workers, through the newsletter, the listserv. We had 115 completed surveys, which this gave us an initial sense of sort of the stakeholders' perspectives on mental health care. And then we followed up with participants who were willing to do in-depth interviews and focus groups. So we had 50 interviews that were done in both rural and urban centers in Nova Scotia. And of the 50 participants, 30 were mental health service providers, 10 were supervisors, and then 10 were people who were using services. Again, we were using a narrative method that involved both discourse and descriptive analysis. And with this study, we published a report, which both Anne and Katrina spoke to, and really we had 29 solid recommendations. So I would encourage people to check out the report, which I believe is available on the Nova Scotia College of Social Workers website. And then there was also a paper that was published, a shorter paper summarizing some of those findings as well. Some of the statistics that came out of specifically the Nova Scotia study, again, similar to what we're seeing from the national study, but 98% of social workers believe that there needed to be changes made to the current provision of mental health services. 97% of people indicated they did not believe that there were adequate resources in the community to support the well-being of the community accessing services. 85% believed that there were not sufficient day programs or services available within the community for their clients, such as drop-in programs, faith-based groups or activities, or volunteer work to support them. 96% of people felt that they experienced barriers to providing services, which included a lack of resources, lack of control, and lack of opportunity to implement change. 82% reported that their trainings and perspectives, so social work training and perspectives, did not have enough recognition in the current service delivery system. So that's very consistent. And only 35% of social workers indicated that they were satisfied with their current role. So like really let that piece sink in there. Go down. So really, we had some very consistent themes across the Nova Scotia and national study. And the findings also supported the international research, which really was, demonstrating that increasingly social workers are struggling with the constraining conflation of neoliberalism, managerialism, and biomedicalism. So, some of the really overwhelmingly consistent themes from both the literature and both studies were that there was a dissonance between social work training and the dominance of biomedicalism. So really this, focus in mental health care with an emphasis on individualization, pathologization, and decontextualization, making it very difficult for social workers to practice from an anti-oppressive social justice approach, which is really core to our profession. Second, neoliberalism is contributing to an increase in social inequalities. So we're all seeing this, such as poverty, inadequate and unaffordable housing, food insecurity, and social discrimination, right, resulting in marginalization. And all of this really contributes to the social determinants of mental health. And we know this, but there was also, we're highlighting that there was a lack of attention to diversity, an absence to anti-oppressive approaches to practice when we're looking at how services are being delivered. Social workers overwhelmingly are reporting that they feel, they don't feel valued in the hierarchy of mental health care service provision. Often, again, like a part of that is a contributing factor is really being supervised by non-social workers, not having a voice in the development of policies or shaping how mental health practices and service provision is happening. And really, we heard loud and clear through the study that there is a devaluation of social work and a lack of professional autonomy and voice. Again, so, there's a reliance on these sort of short-term approaches, which are focusing, again, on the individual pathology and deficit, rather than really looking at the systemic barriers through a lens of anti-oppressive practice and social justice. And finally, the dominance of neoliberal managerial policies, which are emphasizing fiscal constraint, cost cutting, efficiency-based versus, quality of care, that there's limited supports and resources. We're seeing increased barriers to accessing mental health services. This idea that there's a one size fits all approach for mental health care, and that has to be, all fitting within a really short-term care perspective. We're seeing long wait lists, a limited number of sessions, and then an increase in paperwork. And then finally, really seeing like a lack of training and supervision. So these are really some of the consistent themes that we're seeing across these studies, but also that has been consistent within the literature.
Hi, everybody. My name's Marjorie, and I'm going to take a little bit of a deeper dive into the themes that emerged from studying the responses that we got from the people that we surveyed. And Caitrin's just given us a bit of an overview. So I'm just going to speak a little bit more about some of those themes. So this theme of conflicting paradigms came up a lot. So a lot of people talked about this. And the predominant conflict was the conflict between the biomedical model, which is really using the DSM and diagnoses and focusing on what the medical profession would describe as symptoms of mental illness, which is a really different way of coming at the issues than a social justice approach, which would be central to social work philosophy. So with a social justice approach, we really would be more focused on the structural causes of mental distress and suffering than on an exclusive looking at the individual and psychological evidence of the mental distress. So just to read one of the quotes from one of the people that participated in the survey. Social work has taught us person first, whereas mental health and its reliance on the DSM promotes a diagnosis first approach, often generalizing the client into a diagnostic category. So I think that summarizes that point well, that we would want to look beyond a diagnosis and look at each individual person's story, and look at the uniqueness of our clients. So for social workers, context and diversity are very important. So we don't really work with clients without being aware of the context of the lives of the people that we're working with, and also the identities and the variance in need in terms of the diversity of clients that we work with. Most of our clients, in fact, are people who are contending with marginalization and discrimination. These are huge social issues in our world today, and they're huge social issues for our clients. And it's something that social workers are very tuned into. And quite often with a kind of mainstream biomedical approach, these issues are not considered at all. A lot of the study participants noticed the effect, in fact, of marginalization and discrimination on people's mental health and their struggles. And also we're very tuned into issues of access, which is also a very big issue in terms of mental health services. If a person feels not heard, not understood, not appreciated, not given dignity, then it's not a helpful service that's being provided to them. And we did get some participants who actually reported that they were witness to mental health staff saying and behaving in a racist way, which also, of course, creates a complete distrust of the whole system when that occurs. So what makes social work unique? And I think that this question of uniqueness is a really important question because I think that our social justice perspective and our broader perspective actually marks us out as different in terms of multidisciplinary teams. So in multidisciplinary teams, sometimes we can be a real minority and have a social justice perspective that's not shared by anybody else on the team. And so this came up in terms of the responses from participants. They understood that the social work perspective had a uniqueness to it, and that the social work concern about issues like health, poverty, employment, gender, race, ableism, and all of the sort of axes of oppression were not shared necessarily by other colleagues in the service. So just to again read one of the quotes was that social workers tend to be more aware of how environmental factors such as poverty, discrimination, domestic violence, abuse, neglect, or inadequate housing have the effect that these have on mental health, and strive to intervene more holistically. So to try and do something about some of those factors that are in fact the source of mental distress. And the other thing that I see that I forgot to talk a little bit about also is that social workers like to use a person-centered, client-centered approach, which has an emphasis on compassion and empathy. So another thing that was reported by a lot of our respondents was that they really felt devalued as social workers. They felt that there wasn't a lot of recognition of what social workers had to offer that was communicated to them within multidisciplinary services that they worked. This also, and it was something Katrin already alluded to, is that a lot of respondents said that their supervisor, in fact, was not a social worker. And that's a really difficult thing to deal with, because if you are being supervised by someone that's not really aware of or in agreement with your major philosophy, then that makes things challenging. A lot of the respondents said that they felt actually respected by their immediate colleagues and particularly by their clients, but that they felt that they were undervalued in terms of the wider system, which of course is strongly biomedical in the case of a lot of mental health services, and also that society at large wasn't necessarily aware of social work's interest in social justice. So a quote on that topic: lack of system-wide recognition of full scope of practice, lack of interdisciplinary team members knowing social work scope, and a lack of emphasis on the social work ability to provide meaningful psychotherapeutic input, and a lack of resources, which is an allusion to the neoliberal issues. So lack of professional autonomy and voice, which really is another issue coming out of the issues that I've just been talking about in terms of feeling devalued. So a lot of people reported that they felt that as a profession, social work doesn't have as much voice as they should have, that there needs to be a wider public understanding of the structural social justice position of social work, and that sometimes this lack of understanding, again in a multidisciplinary context, leads to social workers being asked to do things that really don't have anything to do with their job. So one of the things that I remember a social worker reporting was that she was asked to help a client with their tax return. You know, so it's not really a social worker duty, but sometimes just anything and everything is thrust into the lap of social workers. In the hierarchy, the medical model is pretty high up in the hierarchy, and social workers are pretty low down in the hierarchy. So that was reported by quite a number of participants. And that because of the structuring of governmental and major agencies, it's usually structured so that the authority voices and the lead positions are held by people who are part of the medical model. So just a quote: our input isn't valued as much as others on the team, psychiatry and psychology. Doctors don't read our notes, not as collaborative as we could be for client benefit. They also see us as counselors, where social workers have a lot of knowledge, training, and ideas that would be beneficial to program planning, priority setting, and goals as an organization. Neoliberal managerialism, lack of accessibility and resources. So I think there are a lot of things that come out of neoliberal managerialism, and a big one is accessibility and resources. So many of our respondents reported that there was a lack of resources. So this actually was also a source of moral distress, because social workers felt that they could certainly see what their clients needed in terms of services, and basically the services are just not available, or if the services are available, there's huge wait lists, which is just not helpful at all. So this really being stymied by a lack of resources and a lack of funding for mental health services is a huge problem for social workers in practice. It was exacerbated, of course, by the pandemic. Some participants noted that the most vulnerable people, in fact, were the people that had the least access to mental health services. And that social workers often ended up working really long hours in attempts to reduce barriers and increase access for their clients, and to offer more services than really was feasible for their own well-being to compensate for the lack of resources where they're working. So just again to read a quote from one of the respondents. I mean, it's not adequate at all, by no means. I mean, everybody who works in any form, I think, of healthcare can recognize that. There's so much gatekeeping, you know, very specific criteria is needed in order to get that service. We have, I can't read it, is the thing. Yeah, so you'd better just go on. Yeah, it's covered with the chat notice. So another big issue that also comes out of neoliberalism is the question of efficiency. And I think Katrina and Katrin have both alluded to this. So coming out of the study, actually, we wrote a paper which was critiquing CAPA, which is a common program here in Nova Scotia, and it is wider than Nova Scotia. So it's a kind of an administrative system, and we called it the McDonaldization of social work. So these systems are really based on a business model, and they're really based on the issue of efficiency. So efficiency gets privileged over caring and is seen as being more important than caring, which is a really fundamental conflict issue for social workers in terms of their commitment and their values. So this is a rather long quote, so I'll kind of read it fairly quickly. Government policies which limit care and support for all Canadians. Those who are the vulnerable, who care for our children, women, especially single women and single moms, refugees, immigrants, and those who are not the wealthiest 1%. Sometimes it feels as though we provide band-aid solutions for problems that are being perpetuated and maintained by the wider system. Systemic racism, child welfare system, housing inequity, exploitation of workers, these are ongoing issues that promote unwellness in our communities. We can help individuals to cope and heal, but that's not getting to the root of what is perpetuating these issues. Despite this, the work is needed and valuable to those individuals and to our communities. And finally, there were a number of participants that talked about unionization and talked about unionization as a way of countering the impact of neoliberalism on social work. So 58% of all the respondents were pro-unionization. But there was some confusion expressed by the respondents. So some respondents said that they already belonged to a union, but these were like generalized unions, not specific just to social work, that covered a number of different professions. And they did feel as though a lot of their particular needs weren't being very well represented by unions. So just to read one of the quotes on that. Also, I believe social workers should all be a part of one union instead of spread out so that our needs can be expressed by a stronger voice. I work within a unionized environment. However, no standardized workload mechanism has ever been adopted for counsellors. So I'm just going to leave off there. And I know that Katrina is going to talk a little bit more about unionization. So I'll just pass it back to you, Katrina.
Thanks, Marjorie. Yeah, I'll talk a little bit more about it when we get to that part of the recommendations. So these recommendations are coming out of the national study, and the data that Marjorie was presenting, the quotes were out of the national study. So we were trying to focus primarily on the national study, but link it back to the provincial and the international data. Just to echo entirely what Karin said from the CMHA, we not only do we need to prioritize mental wellness as a social justice issue, but we need to put our money where our mouth is. So what it really requires is an absolutely huge infusion of public funding. That is what would show a real commitment to the need to address the scope of the problem and to provide not just access, but to be creative in the kind of programming that needs to be creative. So we completely concur with Karin, and it's also consistent with the provincial report, the repositioning report, that we need to increase public funding of mental health and addiction services to represent 10% of the total Department of Health and Wellness budgets, as recommended by the World Health Organization. So we're all on the same page with that. Nothing else can happen unless the money's there. So that's why it's the first recommendation. It needs to be acknowledged. Moving on from there to, and these are, if you like, synthesized recommendations, trying to pull together everything that we saw in terms of what it might add up to. So the sort of thematic area of training, supervision, and management is key. As you heard from the data being presented, and by the way, one of the things I do want to say is what this data does is it gives social workers a voice, gives social workers in Nova Scotia a voice and nationally a voice when we talk about what they're telling us. And they're telling us they're not happy, and we need to listen to them because they know what they're talking about. When they say they need to be supervised by social workers, that's absolutely critical, because not being supervised by social workers seems to send them further message that they're not valuable. So we need to have that direct clinical supervision. And also people suggested that ongoing training should be part of what being an employee in the field involves, and that should be paid training that's provided by the employers to keep up to date and to keep well trained. That we need to provide greater opportunity for social work input on policies and practices. In other words, not just told how to practice, but being given that professional autonomy to know how to practice from our own training and experience, and then to use that knowledge base in helping to shape the policies and practices in the places in which we work. Schools of social work across Canada need to do a better job of deliberately and intentionally connecting critical theory and critical practice so that social workers feel more prepared for practice when they graduate. But that doesn't mean what we want to do is train social workers to be able to conduct CBT or DBT as technicians. What we need to be able to do is connect the critical thinking, the social justice, philosophy, and ethics with how that looks in actual practice. How do you practice in a contextualized way? My experience of this as a professor and as a practitioner is that this doesn't just happen accidentally. There has to be a deliberate effort to make those connections, to look at how does the critical thinking show up in practice? What should it look like? And what's actually happening, what we're being told is happening, is that people aren't actually able to use that aspect of their training. That's problematic, because then you want to actually ask the question, what are they practicing? Are they even practicing social work, or have they become assistants to other professions using other professions' paradigms? Now, that's a very critical idea, but it's one we need to chew on a little bit. Social workers need more autonomy to practice from within their own training, their own social work scope of practice, and not be required then to adopt paradigms and approaches that are not only inconsistent with social work, but that they have an opportunity to offer their own approaches. And of course, once again, to have a position at the policy table. Clearly, we can't avoid talking about and shouldn't avoid talking about the centrality of issues of social inequities and mental health and addiction. And how does that get addressed? Well, I mean, at least in part, it involves actually deliberately hiring more diverse social work supervisors and social work service providers. But it goes above and beyond the hiring and, of course, the educating and training. It also means having to adequately consult with communities about culturally appropriate community-based services, rather than being telling communities what they need. We need to be asking communities what they need. And then arguably actually offering services that are inside communities as well, so that they're more accessible and feel more relevant. We also need to continue to offer, it's as though gender has disappeared off the spectrum of things that we talk about in terms of social inequity. Well, that's a big myth, because that isn't the case that it's disappeared. So we need to actually offer gender specific services addressing coexisting issues of mental health, substance use, and trauma. And we know that women have an inordinate amount of trauma, violence, domestic violence, sexual abuse, and incest in their lives that very, very clearly gets associated with traumatic effect, and then mental health issues and substance use. So that is what the research actually clearly demonstrates. And then we need to shift policies to broaden services for mental health wellness. Well, that reiterates a lot of what we've been saying here today, coming out of all the sources. We're not just making it up. It's challenging deliberately the dominance of the biomedical model, expanding the services, as I said, to provide better choices and more community-based nonprofit type services. When I say that, I mean stuff that doesn't involve having to go to a hospital or see a psychiatrist in order to get help. People should be able to get help within their own communities, in nonprofit organizations, with more creative approaches involving things like art, music, dance, animal-assisted interventions, diverse approaches in diverse communities provided by practitioners who have diversity in their own backgrounds. That is, I think, absolutely critical. So we have to stop this top-down way of thinking and strategizing and saying this is what we need. We need to be much more creative in our strategies. And it's not enough either to just provide the access. It's also about challenging the assumption of a biomedical model. Social work positions need to provide opportunities, as I've said, to link critical clinical social work practice with community-based work, advocacy, program, and policy. So that's to Marjorie's point that we're not just counselors. We can do that, but we also can do more things than that. There are many coexisting concurrent issues that need to be addressed in terms of their complexity. They're not being dealt with well. They're not being dealt with well in most places, but they're certainly not being dealt with well here. The issue of concurrent and coexisting issues that include relational injury, trauma, mental health, and substance use. You know, we need to be able to have more services. We need to have more sessions. We need to have more money in that area. We need to have more trained professionals in those areas. And not within a biomedical model, but within a much more holistic approach. And then we absolutely need to remove policies that predetermine the number of sessions a client can receive, that leaves complex cases with people who've had marginalized social backgrounds and experiences with mental health and substance use that come out of that marginalization. I don't mean just for marginalized folks, I mean in general. Deciding ahead of time somebody gets 6 to 8 sessions, regardless of the complexity of the issue, is completely illogical. And that has nothing to do with quality of care. That is completely about efficiency and management. And that's not acceptable. And then last, a public health and education program needs to be expanded to increase public knowledge and awareness about mental health, trauma, and substance use, with attention to issues of prevention, stigma, and discrimination, the role of social work, and also to focus on strengthening the identity of the social work profession. So this is the last slide in our presentation, and we're actually going to be done, I think, a few minutes early. So we are concluding through this national study, much as we did in the provincial study, that social work needs to be repositioned within a hierarchy of mental health professions in terms of the privileging of other paradigms and perspectives above and beyond social work. We don't believe they are more important. We don't believe they're more significant or more helpful. We believe that we have a lot to offer and that it's not being recognized adequately. So we do need to then really recognize this lack of professional practice autonomy and freedom, professional disempowerment and devaluation, the lack of decision-making power and influence on policy in the workplace, and also the unclear institutional and public identity that social workers have. We need to work on that. And we need to really address the fear of replacement by other professions, which social workers sometimes say, which produces a growing moral crisis among us. There's a bit of fear that if we kick up too much of a fuss, we speak too loudly about these issues, that what the systems will do is just decide to hire other people instead of social workers. That fear came up over and over again in both the provincial and the national study. And that's very telling, actually. So under the institutional and social climate of neoliberalism, with its focus on fiscal constraint, in other words, cutting costs, and the rationalization or the tightening of all practices, we've begun to risk our social justice-based professional identities. This is the point on the international six-country study, is we will lose our relevance, we will lose what it is we do that is distinct, that is important, if we continue to just go along with those trends without critiquing them, without offering other alternatives. When social work practice places require social workers to adopt the knowledge and practices of other disciplines. As is a point that's been made multiple times, and it's really a point that we have to keep emphasizing over and over again, because it is an overwhelming, predominant argument throughout. So social workers struggle then to reconcile their own tensions between their own professional training and values and the demands of the workplace. And this leads us then to, well, what are we talking about when we say that? We're talking about, as both Katrin and Marjorie have said, the focus on social justice and care versus individual pathology deficit, and the focus on efficiency and management. Those are things that need to be tackled. We obviously need to address, as everyone has said, and we will continue to say as social workers, because it's literally at the heart of what we do, we have to address the context in which struggles exist. We can't just focus on individual problems. And so given all of this, given this context, given these concerns that social workers have, one of the questions we then deliberately asked in the national study was whether social workers, what they thought about unionizing social work as a profession, whether that might be one of the only ways to redress the kinds of workplace contextual problems that seem to exist largely within the socio-political economic context of neoliberalism. And well, we know from the results that the majority did feel that yes, unionizing might be a way to address that. We did see several other responses. Mostly which were suggestive of the need to educate social workers and provide information on what unionizing is. For instance, there was confusion about whether being unionized was the same thing as belonging to a professional association. They are not the same thing. They do different things. They have different jobs. It would be fantastic if they worked together well. That would be a lovely scenario if we were to take that direction. There were folks who said, well, I already am in a union, the allied union context. And other people said, yeah, but we're not getting our needs met within those unions. My own sense of that is that within unions that are allied, better than having no unionization, but on the other hand, it doesn't really address any of the issues we've articulated. It doesn't address professional practice autonomy and freedom, professional disempowerment and devaluation, lack of decision-making and influence on policy. It doesn't address any of those because it's not specific to the needs of social work. And so that's the big question, I think, given the concerns and critiques social workers have, what can we do? I mean, literally, what can we do about that is where we leave you. One way to address it is through the idea of unionizing. We have seen nurses do this. We've seen them do it effectively where they have been devalued and at the bottom of a medical hierarchy. And we've also seen them do a tremendously powerful job in terms of their public presentation of self through commercials and public campaigns. And so they've really raised their profile and their respect, I think, in general, as a result of their actions, their political actions. This is a political context. I do think that we need to continue to strengthen, I think the research says it, we need to create a collective social work voice. That doesn't mean we all need to agree with each other. We don't. We can continue to have differences of opinion, but we do need to have a much more powerful collective voice and identity so that at least society has a better idea of what social work is, and that other professionals that we work with even have a better idea of what social work is and can be in the context, so that we can contribute what it is we are able to contribute through the full scope of practice that social workers are capable of. So it is possible that we could consider developing a large-scale social campaign that addresses more broadly what social work is and what we would like it to be in terms of workplace realities. So that is it, I believe, for, and then we have many, many references because we did ground all of this study in research at all levels. So we do have a little bit of time before we take a break. We're going to take a break and has set up a break for us all, but at the same time, and then following the break, we're going to have breakout groups for those of you who want to participate in that, so we can further the conversation to get more of your opinion and ideas on things. But if anybody has any questions for the research team right now, we do have a few minutes before we go to break where we could take some of those thoughts or questions.
So thank you so very much. There has been a massive amount of conversation in the chat, as I'm sure that you can probably see, with a lot of very interesting comments. And I think to summarize all of the questions would be a little challenging. We are also at the end of our time, but I know we're going to go into small groups and we're going to have a chance for everyone's voice to be heard with our breakout discussion groups. So I think what we're going to do is please feel free to continue using the chat. However, we are going to take a 5-minute break because we are a 7-minute break because we're 3 minutes over. But it's you've done such a great job, Dr. Brown, Dr. Johnstone, and Katrin, for helping us think about all of these really important issues. And I can't wait to see what we will come up with on our discussion group. So please, everyone, take a few minutes, take a stretch. This is our one break for the afternoon. So of course you can come and go as you wish, but we are just very grateful to everyone for joining us. Thank you.